Going to the washroom to do a number 2 is something that nobody wants to talk about. In fact, most people don't even know what's considered normal when it comes to bathroom habits. Now, how does this relate to low back pain? Keep watching for the answer. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips for dealing with constipation so that we can all benefit in our own personal journey to better health. What is constipation anyway? You probably have constipation if you have to strain quite a bit to go poop, and after all that effort, you're rewarded with dry, hard, and small pieces of poop. Anybody who's ever been constipated and is worried that they might have a heart attack while straining on the toilet tends to avoid going to the washroom in public because it takes so long. What do you think is the normal amount of times you should go poop? Once a day? Twice a day? Once every 3 days? In fact, the normal amount of times to do a number 2 actually can vary between 3 times a day to once every 3 days. But the quality of your poop is actually quite important too. What does your poop look like? The next time you go poop, take a good look. Here's a chart that shows diagrams of normal and abnormal poop called the Bristol Stool Form Scale. Type 1 stool looks like separate, hard lumps like marbles or rabbit poop that is hard to pass. Type 1 stool means you're very constipated. Type 2 stool looks like a sausage with distinct lumps. Type 2 stool means that you are constipated. The next 2 stool types are what are considered to be normal. Type 3 stool looks like a sausage but with cracks rather than lumps, and type 4 stool looks like a snake that is smooth and soft. Now we start getting into the opposite end of the spectrum. Type 5 stool looks like soft blobs that pass easily with clear-cut edges. Type 6 stool are fluffy pieces with ragged edges and looks mushy. Finally, Type 7 stool is watery with no solid pieces. And the final detail you should be thinking about is how much effort it takes for you to go. If it takes you more than 5 minutes, it's considered straining. If you're having to hold your breath and push hard, that's a problem. Straining too hard can lead to painful hemorrhoids and sometimes even rectal prolapse. How is this related to low back pain? There are a number of common reasons for constipation that we'll get into a bit later, but here are 2 other less commonly talked about factors that can lead to a slower passage for your stool. Number 1, pelvic position, and number 2, the state of your muscles in your pelvic area. Your pelvis position or alignment is directly connected to how your spine functions, and your pelvic muscles are directly connected to your spine and hips. Let's get into a bit more detail about your pelvic position and back pain and constipation. When your pelvis is tipped forward, it can look like you have a large low back curvature. A forward tipped pelvis can put more pressure on your spine and discs and pinch the front of your hips, giving you groin pain. This pelvic position also leads to more tightening around the rectum. You can picture it like bending a garden hose too far and causing a kink in the hose. What else would increase this forward tipped pelvis? Raised toilet seats. Many people commonly think that growing older means that we can't do deep squats down to the floor. While it's true that knee stiffness can sometimes make it uncomfortable, that old saying, if you don't use it, you'll lose it, applies here. The less you get your joints to go to end range in full weight bearing, the more stiff and painful you'll get. So go ahead and don't be scared to have your knees and hips bend all the way. Use a piece of furniture to help you get up and down at the beginning, and then work your way into a full squat with your heels down if possible. So what's the best pelvic position for the bathroom? A backwards tip to the pelvis, which looks like a semi-squat position, knees above the hips. You can use a stool to rest your feet on or a squatty potty. A tight obturator internus muscle, which is deep in your pelvis and hip, can make it feel like you have tailbone pain, buttocks pain, hip pain, and sometimes it can radiate down the back of your leg. A couple of stretches that can release those tight pelvic muscles are the figure 4 stretch with your crossed leg more towards the midline of your body. If you don't feel a strong enough stretch, you can progress to the yoga pigeon stretch. Also, you can do the cat and cow stretch. Rather than counting out 30 seconds, try to hold each pose for 10 deep belly breaths, where you inhale all the way and exhale all the way. Visualize blowing up a balloon and then releasing all of the air. What are some other common reasons for constipation? Number 1, ignoring your urge to go. While sometimes it can be good to train your bladder to hold on for a little longer, it's not great for going poop. That's because when you stop yourself, you're tightening up those muscles even more. The poop stays longer in your colon and the water gets sucked up from the stool, making it drier and even harder to pass next time. So when you feel the need to go, do it as soon as possible. It can also be helpful to schedule regular times for bathroom breaks. Number 2, being female. Females are 3 times as likely as men to be constipated. They also are more likely to have colon disorders like Crohn's and irritable bowel syndrome. And they also have a higher incidence of colon cancer than men. I'm sure this isn't a surprise to you if you are a woman. There are a number of reasons for the imbalance between the two genders, and only one of them is actually based on anatomy. I think one of the main reasons is that women feel self-conscious about anything to do with bathroom business, including noises, farts, smells, straining and staining. They'd rather hold it in and delay things until they get back to the privacy of their own home. That could be an entire day. Also, no woman wants to sit on a public toilet seat. So when you hover, you can't position your pelvis properly and empty fully. Also, many women have a tendency to eat more fruits and vegetables than men. On the one hand, extra fiber will increase the bulk of your stools. On the other hand, if you're always delaying the urge to go, more poop gets backed up, and then you have to strain harder later on, leading to hemorrhoids, fissures, and prolapse. Another reason that actually does have something to do with the female anatomy is that pregnancy and delivery can contribute to constipation and hemorrhoids. The final reason as to why females are 3 times as likely than men to be constipated is chronic stress and emotional repression. Number 3, mental health disorders. You've probably had that experience where you feel like you need to go to the bathroom when you feel nervous, like before a big test or a big decision you have to make or a big presentation. That anxiety can really be felt in your gut. Long-term stress can likewise stop your bowels from working properly. Mental stress can start all the way back to childhood trauma or parental neglect and lead to suppression of your feelings and emotions or being a people pleaser. When you're used to holding all of your feelings in, your entire body tightens up, and it's not hard to see how you would have trouble letting it go, so to speak. It's the body's fight or flight reaction. When faced with stress, your body slows down your digestive process. Back in the caveman days, if we came across a lion, the last thing we were concerned with was doing a number 2. Some people don't even realize they have stress because they've lost their mind-body connection. They've ignored their own needs for so long that they can't even recognize their mental state. If this sounds like you, it can be very therapeutic to take some time to stop and think about what your body is trying to tell you. Number 4, age 60 and over. There are 4 main reasons for constipation as you get older. Number 1, normal transit constipation is when you can go frequently, but your stool is hard or you have difficulty passing stool. Number 2, slow transit constipation is when stool takes longer to go through your colon, meaning that you go less frequently and you also have bloating or abdominal pain. Number 3, disorders of defecation, a slowing of rectal muscle contraction or tightness and inability to relax the rectal muscles. Sometimes as you get older, you lose the sensation of stretching and fullness, so you don't realize you need to go. And number 4, medication use and chronic illness. With advancing age, there is a higher percentage of people who are living with chronic diseases like diabetes, thyroid issues, and of course the medications that go along with it that often have constipation as a side effect. So now we get to medications that can cause constipation, which includes some types of sedatives, blood pressure meds, painkillers, anti-inflammatories, iron supplements, and antihistamines. Talk to your doctor or pharmacist to see if you would benefit from a medication review. Number 6, a sedentary lifestyle leads to constipation. Lying on the couch or sitting for most of the day makes for increased back and hip pain and lazy bowels. At a bare minimum, try to walk briskly 10 to 15 minutes every day, especially after sitting for long periods or after meals if you are diabetic. Number 7, overeating or undereating. Both anorexia and morbid obesity are associated with constipation. Eating too little can slow down the passage of stool in your colon. Drinking too little or low intake of fruits and vegetables can also make stool drier and harder to pass. Diets that are high in processed food, fast food, sugar, salt, and fat are associated with constipation. In general, you want to have a diet that is low in processed foods, high in soluble and insoluble fiber, prebiotics and probiotics, and sufficient water intake. The Mediterranean diet is often considered one of the healthiest diets, but everybody is different, so you may need to experiment. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.